Hello and welcome to our ongoing series of compliance webinars presented by Mango. So on to today's topic. Our panellist today is Laurie O'Donoghue. Over to you, Laurie, and tell us about the really interesting topic of the provision of information, training, instruction and supervision duties for workplace health and safety.
Thank you, Craig, and welcome everybody. So today's topic is about training in relation to workplace health and safety. And really I'm only going to cover two key areas, and that is the duties to provide information, training and supervision, and what the duties are under the legislation, and really what are 5 steps to effective health and safety training. And I'll put that linkage together as we go through the webinar. So just to recap on a couple of things to see where we're coming from with the training area, we just need to step back and look at what the duties are of a person conducting a business or undertaking, or a PCBU. So all PCBUs have a primary care to ensure the health and safety of workers at work, and that the workers' activities are influenced or directed by the work, or of the persons, ensuring they're not put at risk from work carried out as part of the conduct or business or undertaking. Now what that does is that gives you basically a very general statement. Legislation then goes on to say that to meet those primary duties, it's broad and it provides for a number of things. Now the one I want to focus in on today is that it provides for the information, training, instruction and supervision that is necessary to protect persons from risks to health and safety arising from work. So that is a statement out of the Workplace Health and Safety Act, and as usual, and as occurs in most of these circumstances, if we go to the regulation, and Craig quite kindly brought this to my attention a couple of days ago, that the regulation 2016 has been published, and section 9 actually says that there is a duty to provide information, supervision, training and instruction. And it's now very specific about what that will be. The PCBU must ensure that every worker who does work of any kind, uses plant of any kind, or deals with a substance of any kind that is capable of causing a risk in the workplace, either has such knowledge and experience of similar places and work plant or substances, or is supervised by a person who has that knowledge and experience, and is adequately trained in the safe use of all plant, substances, objects, substances and equipment that the worker is or may be required to use or handle, and or protective clothing that the worker is or may be required to wear. So it's very specific in that we've got to provide and ensure that the person knows what they're doing within our workplace, and that they're supervised by people who also have the knowledge and experience.
Mm-hmm. Could I just pause you there? Could I just pause you there?
Sure.
Just Laurie, just a couple of comments from people. There was a slight error on the very first page. It says 2015. It should say February 2016. But this is
was it?
Back. Don't worry. Yeah. So we'll update the presentation to show that it's 2016. That was on the very first slide, Laurie, I think.
Oh, okay. All right. That's quite possible, because the original regulation that I looked at was 2015, and it's only because it's brought out in the last few days. I must have missed that one when I did the slide. Right.
Yeah. So just on this one here, so this new regulation that's come through, is this based on what's happening in Australia? Is this a similar type regulation?
It's actually slightly expanded on what we have in Australia.
Mm-hmm.
There's really just one statement that addresses that people in Australia, or under the model work health and safety legislation, have to provide the training, information, instruction and supervision. It doesn't go into that section 9 in as much detail, right. But having said that, the next section is just about identical.
Right.
Okay. That the PCBU must ensure that supervision and training provided to a worker is suitable and adequate, having regard to the nature of the work that's being carried out, the nature of the risks associated with the work at the time the supervision or training is provided, and the control measures implemented in relation to the work the worker is undertaking. So if you summarise that, the supervision and training that is provided must be relevant to that workplace, the risks in that workplace and the control measures in that workplace. Right? And that's one of the areas we see where training is sometimes, if it's been done through an accredited course or a qualification, doesn't necessarily match up with the training that is required to carry out that work in a workplace.
Can you
also
give an example of that? Is that
well, an example of that might be that we train somebody on a forklift in a factory or in a, say, department hardware store. Right? What that will do is that will give him a high-risk work license to operate a forklift. Okay, but he may then work and move to the waterfront where he's actually lifting containers related to ship loading using a forklift. They're two different types of work. The simple fact that he's had training or he or she has had training in a forklift doesn't necessarily mean that they've had the training that is relevant to the workplace that they are working in.
Right.
And it's a situation that we come often, that people have got their high-risk work license, and all employers do and PCBUs do is check to make sure that person has that high-risk work license. It doesn't necessarily mean that when they did their training that they carried out work that is relevant to the work that is carried out in your workplace, and it'll be up to the PCBU to make sure that that is the case. Okay?
Right.
So that's what we're talking about. The training doesn't always necessarily match up with your issues in your workplace. And the PCBU must ensure, so far as reasonably practicable, that the training is readily understandable by any person to whom it is provided. And in your regulation, it basically says that training includes the provision of information and instruction. So when we start to talk about training, we incorporate the terms information and instruction in that, rather than repeating the whole three words. So for the rest of the webinar, if I'm talking about training, I'm also talking about the provision of information and instruction. Okay? So I just wanted to give you a recent court case history here, right, that popped up only a couple of weeks ago in my inbox. So here's a recent case of a 60-year-old New South Wales farm worker who died in a hospital following injuries he received after falling 2.5 metres from a hothouse roof. The man lost his balance while attempting to recover a plastic covering on the building. The court determined that the risk of falling from the roof was foreseeable and could have been minimised if the PCBU had completed a risk assessment and put safe procedures in place. The court found that the worker did not receive training or assistance to work safely at heights or on the roof, and there was inadequate supervision. And the Executive Director of Safe Work New South Wales basically said, by failing to provide appropriate equipment, training, instruction and supervision to prevent workers from falling from heights, the business committed a significant breach of safety laws. Right? And in that particular case, the PCBU and the director was fined $165,000.
Each or in total?
No, combined. Combined. Right, so that was a combined fine. If anyone wants to take the time to go and look at court cases in Queensland or in New South Wales or in Victoria, you'll actually find that there are numerous examples where the courts found there was inadequate information, instruction or supervision. Right? In auditing, it's an area that I find that is often deficient. Right? We make sure the equipment's safe, we make sure the workplace is safe, but we don't provide the information, instruction or supervision to workers. Okay, so just some other issues that appear in the regulation, and I just wanted to touch on them. Throughout the regulations, you are going to see the term a competent person, right? And it defines what a competent person. Now that can be specifically defined in the regulation or the code of practice. Right? So, for example, a competent person who is going to carry out asbestos assessments, it defines what that competency is. Right? So it defines the course the person must attend and the training they must receive. Right? In all other cases where it doesn't specifically define it, then what it says is that the person who has acquired through training, qualification or experience the knowledge and skills to carry out the task. So in those cases we have to be able to illustrate within our organisation that if it's not specified, so we can do a direct match within the legislation, we have to be able to show that we've got evidence that they have that competency. Right?
Mm-hmm.
The regulation or the code
of competency is made up of training, qualification and experience.
Yes.
Essentially.
Yeah. It could be in isolation or in combination too, Craig. So it's not necessarily all of them. It might be simply that they have a qualification, or it might be that they're just able to illustrate experience in a certain area.
Okay, just a question here from Sherry, which is timely, which sort of looks at the previous slide, was by what standard can a PCBU assess and assure themselves that information, instruction and training they provide is sufficient? Don't regulators usually apply the 20/20 hindsight? So, you know, how can a PCBU assess and assure themselves that it's sufficient?
We're probably jumping a little bit ahead in the rest of the presentation, because that's really about determining what training your people require, the information and the instruction that they require.
Okay, so we'll come to that.
There's no hard and fast rule. A decision has to be made by the organisation. Just a couple of other things I wanted to mention on here, that the regulations, or in some cases a code of practice, can define the information, training and instruction that's required. For example, if you look at the regulations, it actually, well, certainly the model regulations, confined space entry, it actually defines exactly what items have to be addressed by the confined space entry training. So the regulation actually outlines the training that is required. Okay. In some instances, it might be, for example, high-risk work. Okay. So high-risk work, certainly in Australia, I'm not quite sure what the situation is going to be in NZ, but high-risk work is going to be scaffolding, forklift operation and those types of things, where we have national competency standards, and people have to be assessed against those national competency standards. Right? So one of the unfortunate things, or difficult things of the training side, is you have to look at each area in isolation. You can't make generic statements in relation to how things are going to be addressed within a particular organisation. And that's really where we move on to the next section, because what I've covered there is really what is required under legislation. And as you can probably realise, I think what Sherry highlighted is, how do you show what you're actually, that you're actually meeting your duty under the regulation and under the Act. Okay. So before I move on to that, I just wanted to reinforce also that whilst we have a legislative requirement for training, it's also an investment within our organisation. Right? So when we look at delivering training to our workers, then we need to look at it as also an investment. And we need to look obviously at the cost of the training, that's part of the investment, and the time given for training. So, you know, if you've got 8 blokes who are going to be trained for a one-day course, that's the equivalent of 8 working days that it is going to cost for that training. Right? So if we're going to look at training within our organisations to meet both our legislative requirements and to make sure that we're getting a return for our investment for that training, then we've got to make sure that the training is effective. And I'll just use the term effective. Right? So that begs the question, what is effective training? What are we actually going to achieve, or what do we have to do to achieve effective training? Well, let's first of all look at what we're going to be actually trying to achieve with that training. First of all, that the workers gain or maintain the skills and knowledge they need. A, to perform their work. B, to direct others to perform work. Or C, to supervise the work. And those three obviously link together. The effective training should also address the health and safety training needs of the organisation. So what is actually required by that organisation? And if I can just give a quick example of that, we have a situation over here that to carry out dogging work, you require a dogger's license, which is a high-risk work license. Right? Now, that course is fairly extensive. It's a 5-day course and a fair amount of assessment in it, and a fairly high-cost course. Right? Now, basically what a dogger does is a dogger decides on when a lift is going to occur, on evaluating what the weight of the lift is going to be, and also the method of conducting the lift. Okay. Now, we have things like vehicle loading cranes that sit on the back of utes that lift items onto the back of the ute. Now, if you look at the words of the regulation, anybody who hooks up a load onto that particular HIAB would require the high-risk work license of a dogger. Okay? Mm-hmm. But if a person is not actually making a decision about the lifting technique or the weight of the items being lifted, then there is no requirement to be a dogger. So therefore it is quite acceptable for an organisation to have a dogger develop work procedures that define the methods and the weights of the items to be lifted, and an organisation then can do internal training to match up with what they're going to be lifting. Right? Mm-hmm. So they don't have to be sent out to an external course. So what we're saying there is we've really got to look at what training is required. It's not just a matter of sending people away to a training course. It's a matter of looking at what is actually required, A, by legislation, and B, by the needs of the organisation.
Right, and that's fine. So you could have doggers that don't have a certified licence but have been trained by someone who has been They wouldn't be a dogger. Right. Craig, what they would be is they would be somebody who is simply trained in hooking up a sleeper to a HIAB on the back of a ute, and they're trained in the methodology and the type of equipment that has to be used to do it. Right. Okay? Because they're making no decisions about the actual lifting techniques. Okay. That the training achieves the specific outcomes required. In other words, are we providing training that is going to meet the specific outcomes required by the organisation? Is the training cost efficient whilst ensuring that the time and money is a good investment? So there's a need for an organisation to actually evaluate what training is given, and are they getting what they want for the money that they're paying out? And the last thing is obviously that the training addresses the health and safety legislative requirements, in other words the primary duty, and also any specific requirements within a regulation or a code of practice. So in a nutshell, that is what we would regard as effective training. Right. So any questions at this point? Yeah, I think there's more of a comment here from Sherry again, is that in the USA many organisations have changed from using return on investment, ROI, to VOI, which is value of investment. Much better way to look at it. So it's just a comment there from Sherry. Yeah, I have no disagreement with that comment at all. Okay. So how do we achieve that? Well, I'm sure a lot of you or a lot of the people with us today have actually seen this. We need to work out what the health and safety training is required, establish how this training is to be provided, identify who can prepare or provide the training, deliver the training, and evaluate the training. Now, I think some of those steps look fairly obvious, but I just want to expand on them in relation to how we meet that as far as our duties under the legislation, and also make sure that we do get effective training. To determine our training needs, okay, we need to look at obviously the nature of hazards and risks in our workplace. And you can look at it as a little bit of a scale. The higher the risk, the greater the need for looking at the level of training that we provide to the workers. We need to look at our processes that we use for our hazard identification, risk assessment and risk control, and the need for and the proper use of those control measures. We need to look at our standard work procedures. To what level of training do we need
training in those standard work procedures. So for example, again, excuse me, if we have a standard work procedure for a clerical activity, then the level of training would be possibly minimal apart from maybe an outcome basis. Right? But from a health and safety risk point of view, the training is probably minimal. Whereas if we're using a chipper, and we've got people using chippers for chewing up foliage, then the amount of training we would provide to them would be substantially higher. We need to look at the duties and responsibilities of workers, supervisors and management and what their training requirements are. If I can give a quick example of that. For example, we often require that supervisors do pre-start meetings or conduct toolbox talks. Right? Yet often the supervisors aren't given any training or understanding of what that actually entails. So as a result, we end up with very poor pre-start meetings or very poor toolbox talks. So it can be simply giving training to people within our organisation, right, information about the way they carry out their task. The other thing that we need to look at is we sometimes train workers to carry out activities, but we don't give the same level of information to their supervisors and management. Mm-hmm. If I can give a quick example of that one, a confined space entry. So we give our workers training in confined space entry. Very detailed course. We train them in how to do risk assessments, to work out how many people they require to carry out the task, to make sure that there's sufficient standby people available in the event that you've got to rescue somebody from a confined space. We've had situations where supervisors were not given the same level of training or at least some understanding of entry into a confined space, and decisions were made overriding the workers' decisions in relation to standby people. We had a situation where somebody was entering a remote confined space, and they determined that to carry out that activity they needed one person to go down and they needed two people on top as standby people in the event that they had to be rescued. They had intimate knowledge of that confined space, and they'd worked out that there was no way one person was going to be able to retrieve that person from the confined space. The supervisor attempted, it didn't succeed, but attempted to reduce the number of workers to 2. That supervisor had not had any training in confined space entry whatsoever. He was looking at it from a purely manning point of view. Now, I'm not having a go at the supervisor there. He hadn't been given adequate training in his decision-making process. Another area we need to look at is consultation. Health and safety reps. There is, I understand, going to be an accredited course in New Zealand for elected health and safety representatives. I'm not too up to date on it. I did see some information on that. Health and safety committees. If we haven't got health and safety reps, we might have health and safety committees. We need to look at what training they require. Okay? Who requires the training? Workers, supervisors, management. In some cases, we might have to give contractors some training. Right? And whether the specific legislative requirements required. Again, relating back to the codes of practice and the regulation. And finally, the last one there is formal assessment required. We need to determine whether we need to do some sort of formal assessment. Now, that's not necessarily carried out by a registered training organisation or something of that nature. It could actually be an internal formal assessment.
Yep.
Right? So, in line with what, and I assume this is the sort of question Cheryl was asking, was how do we prove that the assessment, or how do we prove that the training was adequate for what the person was doing? That's where a decision is made that you might require a formal assessment to be carried out.
Right.
If I can give an example of that, we have a, we work with a tea plantation here in North Queensland, and they operate a very specialised piece of equipment that actually does the tea harvesting. And it's a fairly dangerous piece of equipment in that it's got rotating blades underneath that can be accessed. Now, workers are trained in that operation of that particular equipment, but the organisation has developed and implemented their own formal assessment process where they actually go through how that piece of equipment is operated, the key issues that the operator must take into account when operating that equipment, and so they do a formal assessment, and every 12 to 18 months they do a reassessment of the operators to make sure they are still carrying out the activity in the required way. Okay,
Right.
so that's a decision that has to be made. And if you look at that training requirements, it's often referred to as a training needs analysis or a training matrix that you put together for your organisation.
Yeah, no, that's good. That's quite a nice summary. Just a few comments here, mainly from Sherry again, just saying it's great to see you're considering the training requirements of various levels in the organisation. Managers and supervisors need an appropriate level of understanding of requirements in order to manage work activities, as well as workers needing to understand what they're required to do. I see that quite often when I'm visiting and auditing companies, is you see the skills analysis or the training needs analysis and the training skills matrix, but you don't see, there's nowhere in there do you see the managers on that. You just see the workers. Yep. So something that people should consider is, you know, make sure that the managers and the supervisors are on your training matrix, and that you've assessed their competency, each of those things. So.
And I appreciate that, Craig, because that gives me a bit of a lead into this next slide.
Hold it. One more. One more from Sherry. She's on fire today. Training should be considered from a program perspective that takes into account the various roles and what they need to know, and ensure content is appropriate for each level. So I guess she's just referring to that.
And that's exactly what we're talking about here, is that we need to look at the factors that in the type of training that we present. So, for example, who is the target group? And if I can use the confined space entry as an example for that one, if the target group is the supervisors, we may not take them to the stage where they're actually going to go down into a confined space, learn how to use all of the rescue equipment, breathing apparatus, etc. But if the target group is supervisors and management, it might be simply that they know how to do a risk assessment, determine the hazards and risks associated with a confined space, and the level of controls that are required. Right. But they may not actually carry out the activity. So again, you've got to look at who you're training, what's your intended outcome, right? We need to look at a couple of things. Where will the training be conducted, right? It's not conducive, for example, to do sit-down written assessments if we're going to do the training under a tree in the middle of Cape York, right? It just doesn't work. What time is available for the training? We have to know how much time is going to be allocated for that training, both from the provider's point of view and from the organisation's point of view. What training method would be most appropriate for the training we're going to deliver? In some instances, it might be quite acceptable to do online training, but in other instances, it may not be acceptable to do online training. It might be that it has to be done face-to-face, and the activities carried out so that the trainees can actually demonstrate to the trainer that they understand the activity that's going to be carried out. So again, there's different methods of training. We've got to determine which is most appropriate, and it may be a combination of a number. Is the training required to be accredited or approved? Obviously, if it's under the legislation and it says that you've got to attend an accredited course or approved course, then that training must meet that. But we will have situations where there is accredited training available under a qualification, or approved training is available, and people can be sent away for a 2 or 3 day course. But does it have to be accredited within your organisation? You may carry out one activity, and again, if I can use confined space, I'm sort of sticking with confined space as a bit of a theme here. Confined space, it doesn't state that it has to be an accredited course or approved a course within the legislation. So if I've got an environment where I've got one confined space that I enter within my organisation, I can still meet the legislative requirements by having an internal course that addresses that one confined space, and my workers are trained and assessed on entry into that one confined space. Right? And the last is, can it be delivered internally? Right? Can it be delivered by people within the organisation? Right? and often that's a good way to go because you've got that internal knowledge where an external trainer may not have knowledge of your particular organisation. So just as an example of determining the type of training, in Queensland here we have to provide fire training, and there's requirements under the building safety regulations, by building fire safety regulations, that says we've got to provide fire training. One of the first things it says is that we must provide first response fire and evacuation training, right? And it's stipulated in the regulations that it must be provided to workers within the first days of their employment. In this particular case, it does not need to be accredited training. It can be provided by the workplace using their own internal procedures or resources, but it can also be provided by an external provider. That's acceptable, and it's a non-accredited course. It does not have to be an accredited course for that first response fire and evacuation. Whereas in high occupancy buildings, and I won't go into the definition of that, but it's larger buildings, etc., a fire safety advisor is required under the legislation. Now the legislation specifically states that the training must be accredited, and there are 8 units of competency stipulated which must be achieved to gain fire safety advisor accreditation. So we've got 2 lots of fire training there coming out of the regulations. One is accredited and requires to be delivered by a registered training organisation, whereas the other one is non-accredited and it could be delivered internally within the organisation.
Great.
So, as an extension, once we've determined what sort of training we're going to be looking at, we've got to determine the type of training. Is it an accredited or approved course? Could it be a short course? It could be accredited or non-accredited. Might it be under a vocational or a professional course? For example, if we've got guys working on the road, operating plant, they may do a Cert 3 in civil construction plant operation. Right? Is it a license or a certificate course that's required? Right? Do we address it in induction? Right? Could we address that particular training in a toolbox talk or during our pre-start meetings? Right? Could it be specific task training that is required? And that could be simply on operating a particular type of machine within our organisation. Is it specific hazard training that's required? Do we need emergency procedure training, and what levels? Emergency procedure training in an office block is going to be totally different from emergency procedure training in a chemical plant or in a hospital. Right? We have to determine what level of training is required for each of those. What first aid training is required. Right? And are there any health and safety specific roles that require training within our organisation, such as health and safety reps, health and safety committees, or if we've got health and safety advisors, what level of training do we need to make sure that those health and safety advisors have got? So once we've determined what training we require to give and the type of training that we're going to give, then we've got to determine who is either going to prepare or provide the training. Okay? I say prepare because in some instances it might be preparing the training for an organisation to actually conduct their own internal training, for example. Right?
Yeah.
So if they're going to use an external training organisation, we should be checking to make sure that the training organisation has the knowledge and experience in all relevant health and safety legislation, hazard identification, risk assessment and risk control approach to health and safety, that they have a competency-based approach to training and assessment, and they have knowledge and experience in training adults in the workplace. Right? So first thing I'd say is if you're going to have an organisation assist you with your training, you need to identify that they have the knowledge and experience in your particular industry. Right?
Yeah, that's very important.
Yeah, it is, and it's one, unfortunately, that sometimes is not verified. For example, I'm not pointing the finger in any direction here, but I know of somebody who recently completed their Cert 4 in workplace health and safety, and within a week was delivering Cert 4 work health and safety training. the person doesn't work in health and safety, has never been out on site, does not have any vocational experience in health and safety, yet they are now delivering that training. You've got to check to see what the background is of the people. Can the organisation customise the course to your workplace and training requirements? For example, can it be customised in relation to numeracy and literacy skills that might exist in your organisation? Where we operate here in North Queensland, numeracy and literacy is often a problem with some of our participants. What we have to do is look at how we actually deal with that. It's not just a matter of giving them the skills for literacy and numeracy. It's also sometimes a little bit of hand-holding as they start to do their assessments because of the interpretation of certain words, etc.
Right.
Can they show how they plan to train and assess your workers? What's the methodology that they're going to use? And can they explain what their services will cost and what the costs include? Right? In other words, what are you getting for your money?
Yeah, this is quite a good checklist because this is actually a requirement of the WSMP program we have over here for ACC. So this is actually a good checklist that people can use as part of that program.
Oh, okay. Look, must admit, I'm not familiar with that.
No,
one,
no,
right?
you won't know what the requirements are over here. But this is actually answering one of those questions around, setting up a criteria to assess their competency. Anyway, keep going.
Okay. Now, again, with our training, who can prepare or provide? So that's really going as the organisation. If you're going to look at a training organisation, they're the sort of things you need to look at. But obviously, if you're going to use a trainer, and that a training organisation could provide it, or you could be using your own internal training, then a couple of things. Has that person had experience in training adults in the workplace? Do they have experience in the health and safety issues in your industry so that they have an understanding of it? Do they have the relevant health and safety qualifications and experience? There could be an or in there. Do they have the relevant training qualifications and experience? And do they have up-to-date knowledge? Right? So if I can give an example of that, I've worked with a number of organisations over the years, and we had a trainer at one organisation who used to deliver basically health and safety training. It was something like 13 or 14 years since they were last on site. Right? So in that particular case, I would actually question, I'm not saying they didn't have it, but I would be questioning, do they have the up-to-date knowledge about what is occurring out on site? Right? So make sure the trainer knows what they're talking about, basically. When you're choosing your training provider, I know costs is probably one thing we always have to consider, but I think there is also a whole raft of other things we should be checking in relation to the competency of the training provider. And there's an excellent checklist which you can find on the Australian Skills Quality Authority, which is our governing body here for training. And it's just a fact sheet on choosing a training or education provider. And I suggest people just download that and have a look at it.
Right. Okay. So as I say, I'll be sending these slides out. So the slides, you'll be able to click on the link there and download that document yourself.
Well, it worked when I did it. So,
good.
Craig, so I hope it will work. Okay, so you've now gone through the process of the steps 1, 2 and 3, which is really getting to the point that you are going to deliver the training. Okay. So at the point we deliver the training, then we should ensure that our training environment is suitable for the training being delivered. I've already alluded to that earlier when I spoke about delivering under a tree in the middle of the Cape York. Is it, yeah, I don't know what's like in New Zealand at the moment, we're going through a heat wave in North Queensland. We're getting up to 37 degrees here in Cairns at the moment. To deliver training outside for 3 or 4 hours at the moment would not be a suitable training environment. You really would have trouble keeping your students' attention. Right? We must make sure, and I might add there that it's also, if we're going to have a sit-down course for the day, putting people onto a bench seat for the day is also questionable whether it's a suitable training environment. Make sure our training environment includes equipment and plant which would meet all health and safety legislative requirements. we deliver a number of skills courses, and it's not unusual for us to turn up on site to deliver an on-site course, and we check the inspection dates on the equipment that is being provided to us, even though we ask for it to be up to date, and it's out of date. Right? The worst thing you can do is actually use out-of-date equipment for a training in health and safety. Ensure that where required, assessments are completed. Right? And ensure that those records of training and assessments and renewal requirements are completed and maintained. And obviously that's an area that Mango assists greatly in maintaining those training records.
Yep.
Just a point on training records, I recommend that organisations, I mean in this day and age you can scan, but I recommend that if you have conducted any assessments of any workers, particularly internally, that you maintain a copy of those assessments on your files. We've had more. We keep copies of all of our training records electronically, and on more than one occasion we've had letters from solicitors saying that somebody has been injured at work. You delivered, in this one case it was the white card or the construction induction card. And you did not advise the worker of these particular issues. He wasn't assessed on those particular issues. We were able to pull up his assessment sheet that he'd done, where he'd answered all the questions, send them to the solicitors, and we didn't hear from them again. So it's important to maintain those records as a defence from a common law point of view. I would also suggest that it is evidence that you could provide to an inspector if they came out on site, to be able to show that you are providing training, information and instruction as required under the legislation, which you've got record there. Okay?
So not only do you have the certificate, but you also have the assessment records to show that they've what they checked, they ticked the appropriate box, which is what Bill's made a comment here. You could do a questionnaire to trainees as part of the wrap-up to test their comprehension and follow up with the demonstration of the training. So keeping those assessment documents as part of the record of learning is key to keep that information.
And again, I think it's also relative to, Craig, to the level of risk that's associated with the assessment that you're doing.
Right.
And also, is it renewed? If it's done every year, you keep the latest assessment, those types of things.
Right, yeah.
So there are some components, it's not just a matter of the guys have done, all right? So we've delivered the training. I think it's important then, once the training has been delivered, to make sure that we evaluate that training program, to make sure that we are actually getting what we set out to do. Right? So we need to determine the appropriateness and effectiveness of the training objectives. Did it achieve what we required within our workplace? So, for example, we set out, and again, if I can give an example, some years ago were involved in manual handling training in the hospital environment, and it was changed to when they changed from a no lift to a no lift policy. And we put a number of workers through, or a number of the nursing staff, through manual handling training. And about 2 months after the training had been completed, we went out and did an evaluation, because none of the nurses should have been lifting. They should have been using other techniques rather than actually directly lifting the patients. And we went out with a physiotherapist who provided the training, and what we found is that a proportion of the staff, and actually 3 units out of the 4, were doing it really well. The 4th unit wasn't doing it really well. So we had to determine why they weren't following and achieving the training objectives that we set out. Okay?
Right.
Make sure that the content of the sessions have been carried out as required. Right? I don't know if any of the people with us today have come across the use of YouTube videos in training sessions. One thing that we're finding is sometimes they can be overused, and whilst participants like to sit and watch YouTube videos, it doesn't necessarily address the content of the session. So it's important to check to make sure that the training that we're putting in place is actually meeting the content that we require. An evaluation of the learning of the participants. Right? It may be that if you've sent somebody to an external provider to have some training in whatever topic. When they come back to the workplace, you may have actually, again, a short little questionnaire of the key things that you want to see that those participants have learnt, right?
Right.
Through that, just as a verification. I'm not suggesting that you do every single one of them, but it's just a verification that you're getting and evaluating your training program. And finally, we should always look at the trainer's skills, right? And whether or not they have been getting the message across to the participants. Some trainers are very skilled in certain environments, but they will struggle in other environments. So we just need to check those out.
Just a couple of things here. Another one from Sherry was around the training records. Keep in mind that photos, videos, etc. can also be kept as records if appropriate, not just assessment papers.
Absolutely, Sherry. It's interesting you mentioned that. We're just moving through to, for some of our skills assessments, we're actually now just starting to put together a program to use GoPros with the trainers set up. So as well as the documented one, we'll actually have a video of the student carrying out the actual activity as evidence.
Yeah.
So, great way to go.
Good one. And also, Noel has said, for toolbox talks, I always do a quick revision on the previous week's topic. This provides confirmation of understanding, and retraining can be done for workers that did not pass the assessment at the end of the toolbox. So Noel does something similar.
Yep.
Just sort of verifies that the training has been understood.
Yep, and it's that verification all the way through, and it's interesting, obviously Noel records that as part of the Toolbox Talk record, which again forms part of your records of training and assessments.
Yeah, good.
So, I've covered that one. I went the wrong way. So, just in summary, I just want to summarise. When determining your health and safety training needs, one of the first things you need to do, or mustn't forget, is to check the legislation, particularly to your industry sector, to ensure that you are meeting your legal duties. Right? Again, through audit, it's been identified that organisations aren't really aware of what training they must provide and what checks they must provide according to the regulations, or more particularly the code of practice. A lot of people we find actually go to the regulations, but they don't look at what the code of practice requires. Decide on whether you require accredited or non-accredited training, and obviously find the most appropriate provider. Ask questions. Ensure that the training offered is suited to your needs, and check on things like refresher requirements, licensing, accreditations, and the reputation of the training organisation. And finally, keep records of training and assessment, and update the training as required by your internal policies, etc. Right? The legislation and your industry best practice. And I'd just like to finish up, Craig, I'm a couple of minutes early here, but just finish up. I don't know whether anybody's been following the issues that we've been having in Australia in relation to training. That there's been a fair amount of rorting, for the want of a better term, of funded training, etc. In a way, training has actually become a money-making industry in Australia. And unfortunately, the result of that is that we're seeing a lot of training that is provided doesn't meet the training requirements, and people are not actually getting what they're paying for. And there seems to be a perception sometimes that providing I have had the person trained and I have got a certificate there to say that they have been trained, I'm meeting my duty under the legislation. Right? Unless as a PCBU we verify that that training is adequate, then we really aren't meeting our duty.
Okay, so just having a certificate doesn't mean that you're meeting the duty. You've actually got to verify.
You've got to verify. You can't just accept that certificate. And the other problem we have is that we've got licenses that were issued 10, 20 years ago. Equipment changes in that time. Practices change in that time. Unless the person has been refreshed and brought a date up to date on that, they are not current in their knowledge to operate plant, equipment, or procedures.
Right. Okay,
So it's an area.
yeah, a comment here from Sherry again saying this is exactly why it is important to identify the competency requirements at the very start before you even start looking for a provider. So work out what you need for a start, determine your health and safety training needs, not forgetting, like you say, that first bullet point, don't forget to check the legislation, particularly in your industry sector, before you, to ensure that you're meeting your legal duties before you even got the provider. So I think people forget that.
Yes, absolutely, absolutely. So it's an area, I mean, we've skimmed over it today, Craig, and just done a very, very broad brush approach or a broad view of it. But a large number of those key points in themselves could be a subject of a detailed discussion. You know, how you determine the training, how you maintain your matrix, how you put your matrix together, how do you get the information out of your training providers, how do you put together an assessment tool, all of those types of things.
Yep, okay. Another comment from Sherry, even a recommendation may or may not be reliable. If you can, sit on some sessions and see the provider at work. So do people come and sit in on any of the training that you provide before they engage you guys, or?
I would say probably not before we provide, but certainly if we're going to provide to the organisation, it is not unusual for the first course we deliver for someone to come in and sit on it.
Right.
So it's evaluated at the first session that we start to work with an organisation to make sure that we are doing what we are supposed to be doing.
Right.
But I haven't had anyone actually come in and do a sort of check out before and sit in on a course. Mind you, they may have done, they may have booked themselves into a course and come and checked us out without us knowing.
Right.
So I suppose that is possible.
A couple of interesting comments here from Derek saying we must remember that training is a control measure as part of a risk assessment, and it is quite far down the hierarchy of risk control, down under administration.
Yep. So, and again, it's an important one that we should be able to show through our risk management process why we have decided, particularly if we decide of training as its only form of control. It's under the regulations here in Queensland. It actually states that if we're working at heights and we are going to use an administrative control or personal protective equipment as our only form of control, we must be able to show why we have discarded or not put in place higher in the hierarchy. In other words, putting in edge protection or something of that nature. So
how do you do that?
In some cases, sorry?
How do you do that? Do you document why you've discarded those other controls?
It actually states that the safe work method statement must illustrate why you've discarded those controls as to why you haven't put them in place, as far as reasonably practicable. So, you know, for example, in North Queensland, if I just use a quick example, if we've got a leak on a roof on an island in the middle of the Torres Strait, the only cost-effective way might be to provide the person with a travel restraint system to go up on the roof and actually fix that leak. The cost of bringing in edge protection and the time to bring in edge protection might be the basis on which we've made that decision. Okay?
Right.
So we can actually substantiate it through the risk management process.
Right. Good one. And last comment here from Sherry, because we're just running out of time. This has been excellent in capital letters. It's great to hear from someone who has thought more deeply about the outcomes, begin with the end in mind. So thanks for that, Laurie.
I appreciate the comment.
Yeah.
I appreciate the comment.
And I think we're out of comments now, so thank you. That's been brilliant.